Mrs. Patterson had been coming for monthly massages at Serenity Spa for 6 months, always requesting Lisa specifically. She loved how thorough Lisa was, how she seemed to know exactly where tension lived in her body. What Mrs. Patterson didn't know was that her massage therapist was actually Dr. Lisa Chen, oncologist, who'd spent 20 years detecting cancer through touch. Welcome to Secret Human Stories. Before I tell you this incredible story of healing hands and hidden expertise, tell me in the comments what city you're watching from today. And if you believe stories like this deserve to be told, hit that subscribe button. Because sometimes the most important medical discoveries happen not in hospitals, but in peaceful spa rooms where clients think they're just getting relaxation therapy. Lisa Chen was everything clients wanted in a massage therapist. At 48, she had the perfect combination of technical skill and intuitive touch that made every session feel both therapeutic and deeply relaxing. Her treatment room at Serenity Spa was a sanctuary of calm, soft lighting, gentle music, essential oils that created an atmosphere of healing and peace. For 3 years, Lisa had built a devoted clientele who drove from across the city to experience her unique approach to massage therapy. Clients appreciated her thorough consultations, her ability to target specific problem areas, and her remarkable knowledge of anatomy and physiology. Many said that Lisa's massages felt different from others they'd experienced. More precise, more medically informed, more like treatment than simple relaxation. Lisa's technique was indeed unique, though her clients didn't understand why. She conducted what appeared to be standard massage therapy, but was actually systematic palpation examinations of muscle tissue, lymphatic systems, and underlying structures. Her touch was simultaneously therapeutic and diagnostic, trained to recognize not just muscle tension, but tissue abnormalities that could indicate serious medical conditions. The clients who sought out Lisa's services had no idea they were receiving care from someone whose hands had been trained for much more than massage. The gentle fingers that worked out knots and relieved stress had once performed cancer surgeries, conducted diagnostic examinations, and delivered life-saving medical interventions to thousands of patients. From 1998 to 2021, Dr. Lisa Chen had been one of the region's most respected oncologists, specializing in lymphoma and other blood cancers. For 23 years, she'd worked at Metropolitan Cancer Center, building a practice that combined cutting-edge medical treatment with compassionate patient care. Her colleagues knew her as a physician who could diagnose complex cases through physical examination alone, often identifying cancers that other doctors missed. Dr. Chen's specialty had been early detection through manual examination, an increasingly rare skill in an era of high-tech diagnostic imaging. While other oncologists relied primarily on scans and blood tests, Lisa had maintained the traditional medical arts of palpation and physical assessment. Her hands had been trained to detect subtle changes in tissue density, lymph node enlargement, and organ positioning that could indicate malignancy weeks or months before symptoms appeared. Over 2 decades, Lisa had diagnosed 1,247 cases of cancer, with an early detection rate that was exceptional even among specialists. Her ability to identify lymphomas through manual examination had saved countless lives by catching diseases in stages when treatment was most effective. She'd published research on tactile diagnostic techniques and had trained medical students in the art of hands-on examination. But the emotional cost of 23 years in oncology had been devastating. Constant exposure to suffering and death, the pressure of delivering terminal diagnoses, and the weight of making life or death treatment decisions had created a level of stress that was no longer sustainable. Lisa had reached a point where she dreaded going to work, where every patient interaction reminded her of cases she'd lost, where the joy of healing had been overwhelmed by the trauma of fighting a disease that won too often. The breaking point had come during the Henderson case, a 7-year-old boy with acute lymphoblastic leukemia whose treatment had failed despite Lisa's best efforts. Watching that little boy's family struggle with grief while she delivered updates about declining white cell counts and experimental treatment options had finally convinced Lisa that she needed to step away from oncology practice. But Lisa hadn't wanted to leave medicine entirely. Her diagnostic skills and medical knowledge were too valuable to abandon, and she still felt called to help people heal. The transition to massage therapy had seemed like a perfect solution. using her anatomical expertise and healing touch in a context focused on wellness rather than disease, helping healthy people maintain their vitality instead of fighting desperately to save the critically ill. The massage therapy certification had been easy for someone with Lisa's medical background. The business side had been more challenging, but within a year, she'd established herself at Serenity Spa as their most skilled practitioner. For 3 years, she'd successfully convinced herself that her days of medical diagnosis were over, that she was simply a massage therapist, helping people relax and relieve everyday tension. Until Tuesday afternoon, November 14th, when Mrs. Eleanor Patterson arrived for her regular monthly appointment, and Lisa's medical instincts detected something that would force her to become Dr. Chen again. Mrs. Patterson was one of Lisa's favorite clients, a vibrant 62-year-old retired teacher who treated her monthly massages as essential self-care. Eleanor was health-conscious, active, and had no significant medical history beyond the usual aches and pains of an active lifestyle. She came to Lisa for stress relief and muscle maintenance, always cheerful and grateful for the therapeutic benefits she experienced. "Hello, Mrs. Patterson," Lisa greeted her warmly as Eleanor settled onto the massage table. "How have you been feeling since last month? Any new areas of tension or discomfort?" "Oh, you know how it is," Eleanor replied with a laugh. "I've been working in the garden getting ready for winter, so my shoulders are a bit tight, and I think I slept wrong last week. There's a spot near my shoulder blade that's been bothering me." Lisa began her session with the standard consultation and assessment, but her medical training automatically conducted a more comprehensive evaluation than typical massage therapy protocols. As her hands began working on Eleanor's neck and shoulder region, she immediately noticed something concerning. The lymph nodes along Eleanor's neck were enlarged, not dramatically, but in a pattern that Lisa's oncological experience recognized as potentially significant. The enlargement was bilateral and involved multiple node groups, suggesting systemic rather than localized inflammation. Most troubling, the nodes had a firm, non-tender quality that in Lisa's medical experience often indicated malignancy rather than infection. Lisa continued the massage while conducting what was essentially a clinical examination disguised as therapeutic bodywork. She palpated Eleanor's axillary lymph nodes under the guise of working on shoulder tension, checked the supraclavicular region while addressing neck stiffness, and examined the abdomen during what appeared to be routine lower back treatment. What Lisa discovered made her stomach drop. Eleanor had enlarged lymph nodes in multiple regions, cervical, axillary, and inguinal, in a distribution pattern that Lisa had seen hundreds of times during her oncology career. The lymphadenopathy was consistent with systemic lymphoma, possibly Hodgkin's disease, based on the specific node groups involved. But the most concerning finding came when Lisa worked on the area Eleanor had mentioned, the spot near her shoulder blade that had been bothering her. What Eleanor described as muscle tension was actually a palpable mass, approximately 3 centimeters, with characteristics that Lisa's trained hands immediately recognized as a potential lymphoma manifestation. Lisa's professional instincts warred with her civilian identity. As a massage therapist, she should simply recommend that Eleanor see her doctor about the muscle tension. As an oncologist with 23 years of experience, she knew that Eleanor likely had cancer that needed immediate diagnosis and treatment. "Mrs. Patterson," Lisa said carefully, continuing the massage while gathering more information, "have you been feeling unusually tired lately? Any unexplained weight loss or night sweats?" "Well, now that you mention it, I have been more tired than usual," Eleanor admitted. "I thought it was just the change of seasons and being busy with holiday preparations. And I've been waking up with night sweats, but I assumed it was hormonal. You know how menopause can affect your sleep?" Lisa's heart sank. Fatigue, night sweats, and unexplained lymphadenopathy formed the classic triad of lymphoma symptoms. Eleanor was describing textbook B symptoms, systemic manifestations that indicated advanced disease requiring immediate medical attention. Lisa faced an impossible decision. She could complete the massage session and hope that Eleanor would eventually see a doctor about her symptoms, knowing that delayed diagnosis could mean the difference between curable and terminal disease. Or she could reveal her medical background and potentially save Eleanor's life by ensuring immediate evaluation and treatment. The decision became clear when Lisa felt additional masses during the abdominal portion of the massage, enlarged lymph nodes that suggested the disease had spread to multiple anatomical regions. Eleanor's cancer was likely already at an advanced stage, and every day of delay could affect her prognosis and treatment options. "Mrs. Patterson, I need to talk with you about something important, Lisa said, stopping the massage and helping Eleanor sit up. I have a medical background, and some of what I'm feeling during your massage concerns me. I think you need to see a doctor immediately. Eleanor was confused. Medical background? I thought you were a massage therapist. I am now, Lisa explained carefully, but I'm also a physician. I used to be an oncologist before I transitioned to massage therapy, and what I'm feeling isn't muscle tension. It's enlarged lymph nodes that could indicate a serious condition. The conversation that followed was one of the most difficult Lisa had ever had with a patient. Eleanor's shock at learning her massage therapist was actually a doctor was quickly replaced by fear as Lisa explained the need for immediate medical evaluation. Lisa was careful not to provide a definitive diagnosis. She was no longer practicing medicine and couldn't order tests or provide treatment, but she could recommend urgent referral to appropriate specialists. Dr. Chen, Eleanor said, using Lisa's medical title for the first time. Are you saying I might have cancer? Lisa chose her words carefully. I'm saying that you have physical findings that need immediate medical evaluation. The symptoms you've described, combined with what I can feel during examination, suggest the possibility of a condition that requires prompt diagnosis and treatment. Within hours, Eleanor was being evaluated at Metropolitan Cancer Center's emergency department. Lisa's detailed referral letter, written on her former colleague's letterhead, ensured that Eleanor received immediate attention from the hematology-oncology service. The diagnostic workup confirmed Lisa's assessment. Eleanor had stage 3 Hodgkin lymphoma with involvement of multiple lymph node regions. The biopsy showed classical Hodgkin's disease with mixed cellularity, exactly what Lisa had suspected based on her physical examination findings. But the diagnosis also revealed something crucial. The cancer was caught at a stage where treatment was highly effective. Stage 3. Hodgkin lymphoma had cure rates exceeding 80% when treated promptly with modern chemotherapy protocols. Eleanor's prognosis was excellent, but only because the disease had been identified before symptoms became severe enough to drive her to seek medical care independently. Dr. Sarah Williams, the oncologist who assumed Eleanor's care, called Lisa personally to discuss the case. Lisa, your referral may have saved this woman's life. The lymphadenopathy you detected was significant, but not yet causing symptoms that would have brought her to medical attention for months. By then, we could have been looking at stage 4 disease with a much different prognosis. The word spread quickly through the medical community that Dr. Lisa Chen was working as a massage therapist, but had maintained her diagnostic abilities. Within weeks, Lisa was receiving calls from former colleagues asking for consultations on difficult cases. Other massage therapists began referring clients who had concerning physical findings that needed medical evaluation. But the most important outcome was Eleanor herself. She began treatment immediately and responded beautifully to chemotherapy. 6 months later, she was in complete remission and had returned to her active lifestyle. During one of her follow-up appointments, she stopped by Serenity Spa to thank Lisa. Dr. Chen, Eleanor said, I want you to know that I tell everyone about what you did for me. You saved my life during what I thought was just a relaxation massage. I'm just glad we caught it early, Lisa replied. That's what made all the difference for your treatment. Eleanor's case had transformed Lisa's perspective on her career transition. She realized that she hadn't really left medicine. She'd just found a different way to practice it. Her massage therapy was informed by medical knowledge that allowed her to provide a level of care that purely trained massage therapists couldn't offer. Lisa began developing protocols for identifying clients who might benefit from medical referral, always within the scope of massage therapy practice, but informed by her diagnostic expertise. She couldn't practice medicine in her spa setting, but she could ensure that potential medical conditions were identified and appropriately referred for evaluation. A year after Eleanor's diagnosis, Lisa received an offer from the Metropolitan Cancer Center to join their integrative medicine program. They wanted her to provide massage therapy for cancer patients while serving as a consultant for early detection initiatives. Lisa accepted the position, but with clear boundaries. She would practice massage therapy as her primary role, but would also use her medical background to help identify potential cancers during routine wellness treatments. It was the perfect integration of her healing touch and diagnostic expertise. Today, Lisa Chen works 3 days a week at Serenity Spa and 2 days at Metropolitan Cancer Center's Integrative Medicine Clinic. She still provides the same high-quality massage therapy that her clients have come to love, but now her medical background is acknowledged and integrated into her practice. Her clients know they're receiving care from someone with exceptional medical training, and they feel safer knowing that their massage therapist can recognize potential health issues that need medical attention. Lisa has referred 14 clients for medical evaluation over the past year, resulting in early diagnoses of 3 cancers, 2 autoimmune conditions, and several other treatable medical problems. Eleanor Patterson completed her cancer treatment successfully and has been cancer-free for 18 months. She continues to receive monthly massages from Lisa, but now their relationship includes the profound bond between patient and healer that comes from shared experience with life-threatening illness. Dr. Chen saved my life with her hands, Eleanor tells people, but she also gave me the gift of healing touch that helps me remember how precious good health really is. Lisa's story teaches us something important about the nature of healing and medical expertise. Skills developed through decades of medical training don't disappear when someone changes careers. They evolve and find new applications. The oncologist, who once fought cancer in hospital settings, became the massage therapist who detects cancer in wellness settings, but the fundamental mission remains the same, using expert knowledge and healing touch to protect and preserve human life. Sometimes healing comes through chemotherapy and radiation treatment. Sometimes it comes through therapeutic massage and stress reduction. Lisa Chen learned to provide both, and her clients are healthier because she never stopped being a doctor, even when she became something else entirely. The massage therapist who used to be an oncologist became the massage therapist who still saves lives through early detection. The hands that once performed cancer surgeries now provide healing touch, but they never stopped knowing the difference between healthy tissue and potential malignancy. Lisa clocks out from Serenity Spa every evening at 6 p.m., just like every other massage therapist. But unlike every other practitioner, she goes home knowing that her touch provides more than relaxation and stress relief. It provides the kind of medical assessment that can catch diseases before they become terminal, that can turn massage appointments into life-saving medical interventions. But Lisa's most profound realization came 6 months later, during a conversation with Dr. Williams about the integration of alternative and traditional medicine. "Lisa, what you've accomplished represents the future of healthcare," Dr. Williams said. "You've found a way to provide preventive medical screening in a wellness context that people actually want to participate in. Most patients avoid medical examinations until they're symptomatic, but they eagerly schedule massage appointments for stress relief." Dr. Williams was identifying something that Lisa had begun to understand about her unique position. Traditional medical practice was often reactive. Patients sought care when they felt sick, when symptoms became concerning, when problems had already developed. But wellness services like massage therapy attracted healthy people who wanted to maintain their vitality, creating opportunities for preventive screening that could catch diseases before symptoms appeared. Lisa's approach had evolved into what she privately called diagnostic wellness, using therapeutic touch to provide genuine relaxation and stress relief while simultaneously conducting the kind of physical assessment that could identify serious medical conditions in their earliest stages. Her clients received exactly what they expected from massage therapy, but they also received medical screening that most of them didn't even realize was happening. The ethical implications of this approach required careful consideration. Lisa had consulted with medical ethicists, legal experts, and professional organizations to ensure that her practice met all appropriate standards. She always disclosed her medical background to clients, obtained informed consent for any assessments beyond standard massage therapy, and maintained clear boundaries about what constituted massage therapy versus medical practice. But within those boundaries, Lisa had created something unprecedented, a wellness practice that combined therapeutic benefits with medical surveillance capabilities. Her clients trusted her medical expertise, appreciated her therapeutic skills, and felt safer knowing that their monthly massage included professional health assessment from someone trained to recognize diseases that could threaten their lives. The program Lisa developed at Metropolitan Cancer Center expanded beyond individual patient care to include training components for other massage therapists. Working with the medical education department, she created workshops that taught bodywork practitioners to recognize physical findings that warranted medical referral, always within their scope of practice, but informed by medical knowledge. "We're not training massage therapists to diagnose diseases," Lisa would explain during these educational sessions. "We're teaching them to recognize when their clients might benefit from medical evaluation and how to make appropriate referrals that could save lives." The response from the massage therapy community was overwhelmingly positive. Many practitioners had encountered concerning physical findings during client sessions, but hadn't known how to address them appropriately. Lisa's training provided them with frameworks for identifying potential medical issues and protocols for ensuring that clients received appropriate care without overstepping professional boundaries. 3 years after Eleanor's diagnosis, Lisa received a call that would validate everything she'd been working toward. A massage therapist in Portland, Oregon, who'd attended one of Lisa's training workshops, had identified enlarged lymph nodes in a client during routine treatment. Following Lisa's protocols, the therapist had recommended medical evaluation, leading to the diagnosis of early-stage lymphoma in a 34-year-old mother of 2. "Dr. Chen," the therapist said during their phone conversation, "I wanted you to know that your training literally saved a young mother's life. Without the knowledge you shared about recognizing lymphadenopathy, I would have assumed those swollen areas were just muscle tension." Similar stories began reaching Lisa from massage therapists across the country who had attended her workshops or studied her published protocols. Early detection of skin cancers, identification of cardiovascular abnormalities, recognition of autoimmune conditions. Massage therapists were becoming an informal early warning system for medical conditions that might otherwise go undiagnosed until symptoms became severe. The National Cancer Institute took notice of Lisa's work and invited her to participate in a research study examining the effectiveness of wellness-based screening programs. The preliminary data was remarkable. Clients who received massage therapy from medically trained practitioners were 40% more likely to have cancers detected in early stages compared to those who relied solely on traditional medical screening protocols. Eleanor Patterson became one of Lisa's strongest advocates, speaking at medical conferences about her experience and encouraging other cancer survivors to share their stories. "I was a healthy, active person who felt fine," Eleanor would tell audiences. "I had no symptoms that would have sent me to a doctor. But during what I thought was just a relaxation massage, Dr. Chen detected cancer that could have killed me if it hadn't been caught early." Eleanor's advocacy work led to media attention for Lisa's innovative approach, but Lisa remained focused on patient care rather than publicity. She declined most interview requests, preferring to let her work speak for itself through the lives she'd helped save and the practitioners she'd trained to recognize potential medical emergencies. The integration of Lisa's medical and massage practices had created something unique in healthcare. A model that combined the ancient healing art of therapeutic touch with modern medical diagnostic capabilities. Clients received the relaxation and stress relief they sought while also benefiting from professional medical assessment that could identify life-threatening conditions before symptoms appeared. Today, Lisa's approach has been adopted by wellness centers in 12 states with plans for national expansion. The Chen protocol, as it's become known in integrative medicine circles, represents a new paradigm for preventive healthcare that meets people where they are, in wellness settings focused on maintaining health rather than treating disease. Eleanor Patterson celebrated 5 years of cancer-free survival last month, marking the point where her oncologist declared her officially cured. She continues to receive monthly massages from Lisa, but their relationship has evolved beyond practitioner and client to become a friendship based on shared understanding of how fragile and precious good health really is. "Dr. Chen gave me more than early cancer detection," Eleanor reflects. "She gave me a deeper appreciation for the healing power of human touch and the knowledge that sometimes the most important medical care happens in the most unexpected places. The hidden expertise isn't really hidden. It's integrated into every touch, every assessment, every moment when healing hands meet human need." Eleanor Patterson is alive today because her massage therapist never stopped being a doctor. And sometimes the most important medical examinations happen when patients think they're just receiving wellness care.